Hello. See. It's going. Hello, viewers. Welcome to the live stream of Discovering Health. And this is on KID-AFAN Global Discoveries. We currently live on Facebook, as well as we are currently live on YouTube at Salone Discoveries with KID-AFAN and Isatu Kakay-Diallo Facebook page. So I'm just trying to do some sharing. Please feel free to do the same. Help me share. Our topic today would focus on monkeypox or Mpox because that name has changed since 2022. And we're going to discuss that. We're going to discuss why the name was changed, and we're going to talk about the history behind Mpox. So we just highlighted monkey, but that's eradicated, meaning in a sense we don't use that anymore. We're now going to be using Mpox, and that started since November of 2022 after the last outbreak. Salon family, good day, good afternoon, wherever you find yourself. Mina Dr. Isatu Kakay-Diallo, family nurse practitioner, board certified, and within our today for talk about a program we now Mpox, where we know say it in our country, currently in our country, we want to talk about them. People that don't lost life, people that don't get sick, so many things that don't happen. So as I do right now, just the try for share the live stream on Facebook as well as on YouTube. So we did live now, I took a Jalo Facebook page. We also did live on KID-AFAN Salone Discoveries. We're in Salone Discoveries with KID-AFAN. So if you just join us for help, we share this live stream because, some Monday we go on for know a bit more about just, waiting they go on with the disease in other things and we maybe then get questioned about, we then not been too clear. But I know say a lot of sensitizations that only go around now the country as well as across the world. This not something we don't happen before. Not to the first time this it don't happen. It don't happen, years back, and then we can't talk about the history, we can't talk about the disease itself, we can't talk about how to protect ourselves, as well as how to teach other people them in terms of protection, prevention, and things like that. Because sometimes we too they face people that don't believe in vaccination, but in some reasons it makes sense for them to do so. And sometimes we too they Okay, so you can see me back now the screen for no say we did live on YouTube. We na Salone Discoveries with KID-AFAN. So if you prefer to watch, we na the YouTube channel, feel free to do so. Now the same topic, the same information now they talk about. And also if you prefer to watch now the Facebook, you can do that. And this is not something where you will before come back to them and watch them at a different time, because we want to make sure say people them get the opportunity for watch these, and learn something from them. So welcome to the live stream. Today now the 9th day of June 2025, where we stream live from New York, KID-AFAN Global Discoveries. But before we begin the program, let's do an intro of KID-AFAN Global Discoveries, and also for learn and see what we want to do. They talk about different issues then. But today we really focus on the health side of things. So that's something where we all need for begin the things. Say, what, if I'm healthy, I can be rich, I can do anything where I want to do, right? So viewers watching me both home and around the globe, my name is Dr. Isatu Kakay-Diallo, family nurse practitioner, board certified, and we are today to talk about Mpox. Mpox, it's a virus, that's actually, in our country, Sierra Leone, and also around the globe, even in New York. And we're going to show some statistics. We're going to show what people should know about this particular virus, when it started, what it has led to, and other things that are happening, the history, the facts, and prevention and vaccinations, as well as, things that you can do to protect yourself, protect your family, protect your community, and also protect the world at large. So on that note, we want to start the intro and start the program with the intro for KID-AFAN Global Discoveries. And I am your host. I am your presenter, Dr. Isatu Kakay-Diallo. So let's take a listen and then we'll continue the program. Okay. So what's going to happen in this live stream? I will be speaking in my local dialect as well as that's the Creole. I'm going to be speaking in that as well. I'll be speaking in English language. So I'll put up the presentation slide. I'm still sharing. Please feel free to help me do so. We really want this information to go far, wide, and beyond, because sometimes people see news, but there are a few things they want to know about it. So what can you do? In that note, you want to share the information, you want to disseminate it so that they can understand what's going on, what's out there, what's been said about this, what the WHO, what World Health Organization, what the Center for Disease Control and Prevention is saying about this, what research has been done about this, what are some of the evidence-based practices. That's what we want to talk about today. So Salone found them, as I've been done say, Mina Dr. Isatu Kakay-Diallo, Mina family nurse practitioner, board certified, and live in the United States, New York to be precise. And we didn't have to talk about Mpox. We don't take over so many lives them as well as they go on currently in our country, Sierra Leone. So if you they watch me live, now for help we for share the live stream, now different groups them, different people them we go on for know what they go on. So what you want for can address now, one for address, the history behind this illness when a virus. Of course, we can dive deep into it. And also, but we want to know how to protect ourselves, given that we don't see we brothers them, we sisters them, uncles, aunties them, we don't lost their life. And what's in the current statistics now we country Sierra Leone. So if we talk about that, we want to make sure that more people then get an understanding and information as to what they go on. Not forget to say within the Facebook page when I took a Kakay-Diallo. And also we did live on Salone Discoveries with KID-AFAN. So if you prefer to watch now YouTube, please free for do that. That's not just an intro we do. So I put the presentation slide up so that we can present them. And also if you get question, feel free for bringing question them up now the chat box. So that way we can answer them for you. And that way you self be able for tell somebody. So sometimes when you learn something, the other person need for learn as well. So this now the intro, I mean, like the presentation, we can't start right now. So as I continue for share while I talk to her, or that self-help me for do the same. Okay, so we're gonna do that. So okay, so I think we've done our part in terms of what team we will for share for now, but when ourselves can continue for share, don't forget for like, comment on this particular live stream, and also if you happen to watch this afterwards, we encourage you for make you do the same thing as well. Okay, so if you get any questions, any concern, now for put up. So viewers, as we are starting the program. What we're here to talk about on this 9th day of June 2025 is Mpox. Mpox is a virus disease, that has been going on for years. But what people don't know, it's something that I've actually spoke about in 2022. But then recent cases in Sierra Leone, led to people dying from the virus, as well as, people are still admitted. We still having cases in the country. So we want to encourage you to be part of this discussion, and by ensuring that you can actually send in your message through the chat function if you're watching us on YouTube or on Facebook. So this is something that we believe that you can help other people rather, understand the disease process as well as the symptom management and other things that can happen. So first, we would like to know what is Mpox. Mpox, as we already know, it's a virus. It's a viral zoonotic infection that results in a rash that is similar to the smallpox. However, there is a person to person spread outside of the household, and mortality from the Mpox infection itself are significantly less when you compare that to the smallpox. So they've had that, people had vaccine those days, and we believe it's been eradicated. So your symptom or the infection itself and or the death rate, when people have this, is a little bit less compared to the smallpox that was back then. And also the rash itself, which of the Mpox can also be similar in appearance to other common infectious rashes, such as, those observed in simple varicella zoster viruses. So those are things that we've seen. So we don't want to make a mistake to say, okay, this is just a chicken pox, right? We want people to understand that it is similar to these things, but does that mean it's actually a smallpox, or is it a zoster, which is chicken pox, right? Zoster, varicella zoster virus is the chicken pox that they call, even in my country, that's how we call it, right? But the actual virus itself, that's what it is. So we don't want to have a confusion. Sometimes some of these illnesses or viruses have similar presentations, but with the similar presentations, there is a distinctive, changes. Like you can see something that is a little bit different compared to the other one, and that would help you with your diagnosis. And also when they do a PCR, which is a polymerase chain reaction, in the laboratory, it tells you what this particular illnesses and what are the difference, what you would see in the lab versus what you would see in the actual clinical presentation. So Salone found that waiting I've been just the highlight. Are the highlights for people them for let them understand, say, this virus, this infection, yeah, what they see, where they go on, people then they get boiled, that boil day before them we get something called smallpox. So, and how we can get them, we get them not only from person to person, but it can happen also in different areas. So, and sometimes the boil, it can similar to that chicken pox way that can get, or where that person they don't get. So the chicken pox in resemblance, not for make we forget, say, this actual Mpox, it exists. And how it exists, we then do lab, we then do blood work, how we can change that. You see based on the findings, based on the laboratory findings and the testing we then can do for say, okay, this not the distinctive changes compared to this now, this not that. So if you just join me, welcome to the program. We don't do an intro, we just start. So we do hope say you could stay with me and help me for share this, so that other people then back get for watch them and get the opportunity for learn something today. Even what thing they don't learn, we just want for add to it. And also we believe say you can yourself can able for help we and come up with your questions them, and then they can help we as much. So we get Amza Toure where they join me. It is a thank you for the update, Doc. Thank you too. Thanks for joining, and we encourage everybody with now for bringing the question and also answer. So we can able for discuss. As we do the presentation, we also don't mind for answer questions and way you get, or if you can one back, you wait till the end of the presentation, you ask your questions, and even after the live stream you can do that as well. I will always go back and respond as much as I can before respond during the chat function. And then, some other things then back where we want to let people then see, it's the fact that, Mpox, where we know say them we call them monkeypox, now viral disease where we say it happen because of there's this pox virus, where then they call Mpox. Now, not the actual virus within itself. So when you go to the scientific level, you know now say, okay, this now because of this make this they happen, right? So the actual biology or the chemistry or the disease process, get to be something different than what we see out there. So as we continue, the name was changed after a public and community concerns for stigmatization. Because when you say something like monkeypox, the first thing when they come to the person in mind, then it feels say, oh, does that mean this now monkey now lead to this and that? So because of that, the World Health Organization, when at WHO, back in 2022, that now November, and the exact date, if you go to the website, you see wherein then say, wait till make them change the name. Right, the name was changed for over a year period. Go in and do. Yes, they don't use for the color monkeypox. So even though they don't use for the color monkeypox, but for give people then time for get used to the Mpox virus itself, the statement say Mpox, the new name, then give 1 whole year. So that's now within the WHO, in our World Health Organization, try for do. So viewers, the point that I'm trying to make here is that this name was changed in November of 2022, given that there's concerns with stigmatization, just calling a disease or an illness name of an animal or some kind of creature out there, it brings that stigmatization. There was a public concern, there was community concern. So in order to avoid that, the WHO decided to give a year, a full year time period in order for that transition to take place. So as the transition took place, now people are used to the name called Mpox. So we don't have much issues with that going forward. So we are all aware now we should be calling it Mpox rather than, you know, monkeypox. So if you didn't know, now you know. That's some background there. Maybe you've heard it, Mpox, but it was initially called monkeypox. So what happened? So always you want to know what happened, what led to this. That's what's health and clinical research and changes is all about. So it spreads mainly through close contact with someone who has a monkeypox virus, causing this painful enlarged lymph node and fever. So those are three key points to pay attention to. So the person would have a rash. This rash is not the only thing they would present with, but also they would have lymph nodes. What are lymph nodes for? You know, lymph node appears, we have a lot of lymph nodes in our body in different part of our body organs, and disease presents, and then the body tries to fight the infection. In doing so, now you have your lymph nodes appearing, whether it's under your chin, whether it's under your armpits, whether it's under your around your groin area, different part, depending where the actual problem is happening. But if this is a systemic means it's all over. Then you have local. So then the lymph node appears, and that's signaling that something is going on. And what is going on? There's an illness, there's a virus. So the body wants to fight back. The body wants to see how best they can be part of protecting you. So having a good immune system, you are able to fight off some of these viruses, some of these illnesses. Sometimes when you don't have stronger immune system, we do have people that have immunocompromised. They are immunocompromised because they have some health issue going on. Either they have cancer or they have, HIV, AIDS, and other viruses that lowers their immune system. But your body should be able to fight off certain viruses. Unable to fight certain viruses, then it leads to complications. It leads to progression. And then people now, because it's systemic, now these patients or individuals, that's a clinical finding. It's an objective data symptom. There's shivering, there's different things happening. So you have the rash, you have the enlarged lymph node, then you have fever. And then it makes people very sick, and then it leaves scars, because what scars are left over? These scars are the one from the rashes, these blisters that opens up and then it heals very ugly. We're going to show some of these with our next slides coming up. Okay, so in that, let me also go to my other part of the people that are listening that also would like to understand this in the Creole language. Salone family, we try for say, as always, where you sick, your body can try for fet of infection. So what we say the fet of infection, the fet time with waiting with your immune system, because your body, God creates you in a way that we will fight off some sickness them. Even if you come in contact with somebody way sick, you can able for fight off the virus, right? But some Monday, as he come in contact with person, it is sick. It is sick, then it begins to say get high temperature, they begin to pull boil. And then also something the way I mentioned, where we call lymph node. Lymph node, we get boku of this lymph node now with body. So sometimes in the world don't get upper respiratory, or somebody get cancer, or the person gets any kind of virus where we say the body now they make them think they are the common at your body. Then bump there and bump it under your skin. Okay, they under your skin, but then they begin to pop up. And if you touch yourself, you self they feel the pain. It is painful. So that can appear with somebody will get Mpox. Okay, so and with that, it they get that rash, then the person they get this high temperature. But it can make you very sick, and then in the end, where the boil down burst, as will be mentioned, if you don't get chicken pox where you small, you know how that they look like. They left scar na your body. That scar, they easy no more for let it go away like that. So on that note, we body can try. You can do your own part. But if you're not possible, not get strong immune system, you can end up for, get sick quickly with where you exposed to somebody. And now that makes sometimes where them viruses that happen, we can now ask people them for let them take protection, let them take measures them for make sure say they don't get sicker. If you're not possible you get HIV, you get AIDS, you risk a higher past that possible we not getting viruses there. If you're not possible we get, different illnesses there or immune problems there, like somebody will get sickle cell or somebody will get cancer, then risk higher. So the more you protect yourself, the better it is for you, so that you don't get sick. And because if you get sick, it become detrimental to you because they affect other organs them. So we continue again, we talk about this illness because I interchange between English and also for explain our now we own local Creole. Okay, so and again, viewers, the disease is mainly spread, as we stated, from person to person through close contact. That's the main spread of this, and it includes, but it's not limited to sexual contact. Transmission tend to occur through bodily fluids, lesions of the skin, or any internal mucosal surfaces, such as the mouth or the throat, any respiratory particles or contaminated objects. What does that mean? That means sometimes people don't wash their hands, and that's why the hand washing comes in. And they asking you to wash your hands. Make sure if you're gonna go to the bathroom or you go to public areas and you touch doorknobs, you touch barrels, you touch things in the train. Like if you're traveling in the train, the first thing you do before you put your hand in your mouth, you washing your hands before and after eating and after using the bathroom. All these things are said to you because why? They are evidence based, because hand washing is the single most effective way of eradicating or reducing microorganisms, things that you cannot even see with your bare hands. You wash your hands routinely using hand sanitizers, you can see a difference in how you can cut down and reduce the spread or the transmission of disease. So as we know, say something and then we go in a public area. We'll go there, we can end up for, touch things that we'll not for touch, and then we forget for wash we hand them. And then when you forget for wash your hand, you self know what thing will happen in that note. So then let's say, for example, you go to a public gathering or you come out there, you not just stop at the public gathering, you go now a train, you take a train, take a bus, something, then you not wash your hand, you forget for wash your hand. And then with that, you now go back, you begin touch you hand from that dirty hand they take out, you go touch something where you're not supposed for touch. So all that they then can lead to the sickness who they see they happen, among people them na different parts them na the world. Okay, so hand washing is very effective. Now something where we know for play with because we know say if you wash your hand, you're able for kill germs. You not only kill the germs, but you protect other people them back for let them not go get sick in the process. Because if you sick and then you get your loved one, you get picking them, what if you say will happen to them? You they spread these germs where you don't get. But if you're able for eliminate things and we will lead to that, or avoid things and we will lead to that, you can able protect yourself. Okay, so and always, another form of how this they happen. So if somebody get boiled and that boil they burst and or then get wound and then they don't get wound from this virus, what if you say can happen? You touch them. When you touch them, they end up with the virus. Because why? You don't come in close contact with that. So now that's the research they show. How will they get harm? And also somebody, in partner, maybe, through sexual contact, because man and woman, as we all know, they're supposed for if their intimacy, they happen, the one person sick, the other person, they get harm, and if then they have any other thing where they go on between them, they go get harm. And then in that way. If they sneeze around them, if they cough around them, you can able foresee that. Or maybe then touch something, then they can then touch the domot. But when you touch the domot, you forget to not being cleaner, you forget to not be washed yan. So what if you say go end up for happen to you? So you can end up for be exposed because you don't touch that body fluid. Body fluid meaning like something where now like the saliva where somebody spit, where somebody sneeze, where somebody get caught, you touch them, and then maybe you self get touched, caught, it's very easily transmitted in that format. So now we take hand washing, say that's something we will protect, we loved ones them, as well as it protect the country and the world at large. Because when we talk about infection, it travel from one country to the other, because people they travel every day. You go inside plane, you go inside motor, you touch things that we're not supposed to touch, right? So, and as we continue for talk about, we talk about the overview of Mpox. We not just want for can do presentations. Say, okay, now for what's here and a day for stop. We want for talk about the history. We want to talk about how this end up for happen and all that. So I continue to also highlight, say, in areas where there's animals or carry this virus, like maybe you did some side where the animal then they carry the virus, people then can get this Mpox, when a zoonotic disease, meaning it can spread from animals to humans. So if you're not person or you are somebody that deals with animals, this is part of your work, maybe in agriculture or other things that has to do with animal, and the animal have this zoonotic disease, which is Mpox, you will be exposed. And when you are exposed, you end up with the actual illness or the virus. So it is found in tropical rainforest in Central, East, and West Africa. West Africa, as we know, Sierra Leone found itself there. So currently we have Mpox in the country nationwide. So where small animals such as squirrels. So if you come in contact with squirrels and for some reason this squirrel is infected, it can happen. The Gambian, pouch rats, and also dormice and various species of monkeys may carry this particular virus here. So we get to be careful as we get for do some of them other things that we lack. Don't not forget, say we there at risk. So make sure say you wear gloves, you handle these animals, accordingly, protect yourself so that you don't get these things happening. Since May 2022, Mpox has spread globally, with cases reported from countries without previous documented Mpox transmission. So this is history, right? We're looking at an overview of this particular subject. And then the spread in most countries today from people and also not just animals is great. And this they come up from the World Health Organization. So whatever we are sharing here, we want to back it with evidence and research that have been out there for us. So again, history and facts about Mpox, the outbreak in non-endemic regions. This was back in 2022, May. There was a new outbreak that happened. And that was when I first spoke about this particular virus. And then this new recent one from last year, we just need to talk about it. We just need to talk about health. We can't just talk about other things. I have to talk about health. And I believe many people have been doing that. And we hope that people would take it seriously and see how best we can continue to reduce and minimize the spread of this infection. So being a viral zoonotic infection, it is a endemic in certain parts of Africa. Cases outside of Africa had typically been linked to international travels and also imported animals. So let's be careful on that as well. However, in May of 2022, an outbreak of monkeypox in non-endemic regions was reported and has since evolved thousands of patients in dozens of countries. So let's pay attention to that as well. Most cases have been identified in men who having sex with men, close contact with infectious skin lesions during sexual contact may be likely a mode of transmission. In addition to direct contact with lesional materials or body fluids, person to person transmission can also occur through large respiratory droplets. So that's something to let it sink in. So these large gatherings, these large droplets can be in the air where it can be transmitted. In addition to that direct, in addition to that, the person exposed to Mpox should be monitored for up to 21 days. So that's important. So 21 days. So don't say, oh, because somebody was sick with this illness and then I become exposed to it and I'm fine after a day, 2 or week. No, you need to be monitored up to 21 days in select patients. That is those people with high risk exposures. And also post-exposure vaccination is also warranted. So if you become exposed, you should seek help and get the vaccine, and also monitor your signs and symptoms of Mpox. Salon family, what we need for take from this particular slide. This is not something where we don't happen. 2022 May, there was a larger outbreak. People already travel, then find this now many African countries them worldwide. So and also we already didn't highlight how they get the disease. You get them because if you come in contact with your man or your spouse, whoever the person is, you can, and then you get exposed to the body fluid, like anything where liquid, you can expose through that. And sometimes in the back, then large, somebody will cough big one, or somebody will spit something, and then they get the virus, you can end up forget them that way. But what thing we need for take on this, for no say, when you get exposed, so you don't get exposed to somebody will get Mpox. You need for monitor your symptom. Either you or you for then a place who said they monitor your symptoms for up to 21 days. Okay, we can't show a slide, as we go along. A slide will tell you from the beginning phase and to that 21 days, waiting would they expect from people there. Don't not forget to say, as you they get yourself monitored, it's always, they don't say back where you get exposed. Now you get for monitor your symptoms. During the COVID, and they tell you to monitor for, specific amount of days. You even stay in a house, they go work or they do certain things, quarantine you. You will also find way how you will get the vaccine. Because if you're able to get the vaccine, you also minimize your chance for get more sicker. So don't not forget say that now option for let people they understand about this particular virus here. So we continue again. We for highlight say during I'm not gonna read everything at this particular slide, but these are there for me to just for make I just summarize them. So as always, being that Mpox is an autopox virus, that is, coming from different agents, especially the smallpox, or vaccinia viruses. So then they encourage you for make sure that you take vaccination. Okay, so that's very important. And also, we need for no say it suggested sometimes the epidemiology, with of this particular virus, and also the molecular evidence from the virology standpoint. We'll say virology, somebody where they deal with viruses, somebody where they study virus and diseases and why disease then they happen. Then really want to let there's two distinct, like two separate strains them, right? And they are different geographically in based on certain parts of Africa. So we want for also understand that. Sometimes I need to see why some countries, their cases are rising compared to the others versus while some other countries it's not as much. So these are because the strains are different. even COVID-19, even the influenza, and all these other different, even HIV and AIDS, they are different, strings to it. So what type of strings you have in your country could be different from what the other person has. So Lord not forget, then virus, the person where they study disease, where they study virus, then infection there. For let we all understand, say sometimes some of them viruses there can be different based on how you find yourself, based on the geographical area where you find yourself. So that again can make whether the case they go higher, how long it lasts, how long it is spread, and how fast it is spread, and so forth. So that's not something. And also, which we get for understand, even the North America, we include America, Canada, and Mexico, and also European countries, them, their self can get different strains, them, right, and call them clade 2, right? So there's a clade 2 to this, and also then don't add other ones, say there's a clade 3. So that will tell you, say, this thing, because you see it a rampant now one country, not the same as the other country. No, it's not like that. It could be that the strains are different. Okay, so let's put that into perspective. And then also the virologists then feel, say, the early analysis of this particular virus and the outbreak, is similar, in terms of, the sequence and the strains then where they circulate, like now countries like Nigeria, since 2018 to 2019. That's now from up to date within then they think in terms of this. So the initial sequence, then can get like 15 isolations, then we indicate that there are more mutation in the DNA. So this is important because, what, as we see the cases then they rise, sometimes you get questioned: is the government doing enough? Are people getting vaccine? Are people being educated on how to protect themselves from Mpox? So these are something them where maybe know, say, what, something else is causing this ongoing acceleration of the human adaptation of the disease or circulation of the virus throughout, right? So from them, that's not something where we all therefore take into consideration. So if you see, say, oh, this person been get flu or been get this chicken pox, and you're not last long, and you're not sick too much, but maybe you get a different kind, because when you look at it at the lab, the strain then different. Even America, the European countries then get different strains. In Africa, then point out two different strains then. So that can make the virus they circulate faster. That can make it spread more, and that's not something we'll pay attention to. This is not just the epidemiology of it, epidemiology, why disease they happen, and all that. So let's get a history on that. This history really get for focus on what? It focus on the fact wherein it talks the first isolated case for Mpox was in the late 1950s from a colony of laboratory monkeys from Singapore that were going to be used for polio virus research. So the history behind this monkeypox or Mpox, which it is now, late 1950s. So if you've not been born then, so you don't know bottom. Back then in Singapore, then find out, say, then we want to use this particular case for let them use them towards polio virus, because polio now we know picking their they born in America or inside now self, then forget vaccine for prevent polio, because polio can lead to so many different debilitating conditions, them things and way will be worse than. So that's not something for me we also take from Mpox in this presentation today. So Mpox was also first identified as causes of the disease in human. That was back in 1970s in the Democratic Republic of Congo. So then in the 1970s, that's when they discovered that in human. So as we know, we've got two separate history on this and how we actually end up with the Mpox virus. So in terms of geographic distribution of this particular disease, since the discontinuation of smallpox immunization, which also protects against Mpox, Most cases of Mpox have occurred in Central and West Africa. The first outbreak of Mpox in the Western Hemisphere occurred in the United States was 2003. So because people didn't really get vaccine, or because people were getting vaccination, it was protecting them. And that the vaccine was for smallpox. It was protecting them from Mpox. But since that was discontinued, we don't see that immunization taking place. Now, this is what people are experiencing, because, they don't give the vaccine because it was eradicated. So then they say, okay, we good. World Health Organization give the command, and the countries, we are done with that. But then in 2003, we started seeing uh, people with Mpox, and then it came back 2022 when the name was changed to Mpox versus monkeypox. So as for Central and West Africa, monkeypox or smallpox was first identified as the disease in human, which I mentioned, 1970, after eradication of naturally occurring smallpox in 1977, the discontinuation of the routine smallpox immunization, that is, vaccinia virus vaccine in 1980s, WHO, monitored, the subsequent human monkeypoxes. So there has been a follow-up in this. People that don't they watch the World Health Organization, they do in part for make sure say people them we get exposed or we not get vaccine after the eradication, like return again, right? So and again, WHO was concerned that the elimination of vaccinia virus vaccine, which also protects against monkeypox, would lead to the increased susceptibility of the population and also the possibility of an increased incidence of Mpox infection. This is coming from Up to Date. It's a research, evidence-based. So as you can see, there has been a history, there has been things that, been kept, and they've been monitoring that. So we do want to keep an eye on this, and whatever happened this year is going to be also part of the history of this particular virus. So Fambudem, this is not something where we don't happen for so long. As it happened, WHO at one point, we waiting at the western part of Africa, the central part of Africa, this disease been show up, and also as it show up, time come, they say, well, we don't need vaccination again because we don't see smallpox. But that smallpox in vaccine, if they protect people there for the Mpox, okay, if they protect people them. But and WHO in our World Health Organization, we also raise a concern, say, you know what, if we cut off this vaccine we people and they get for protect them, and if they protect you against Mpox, then we get more cases them, and indeed, maybe not so much, but within the last 10 that we don't appear, 2022 we don't appear, it don't begin to show that. And we also been see there be reports say this happened in America 2003. They mention Nigeria and the Republic of Congo and all that. So for long not spend too much time, I will take a bit of each of these things, and they will therefore get into the actual things and what happen in our own country, Sierra Leone, and how to protect ourselves and protect people them. So this particular slide again, just to give you another glance. So I just left make it a day for a bit, because back in 2005 and 2007, then we get huge number of cases where they identify of monkeypox or Mpox, okay? And that was, due to the lack of immunization. Again, lack of immunization led to this. So it is important now that they have vaccines for Mpox for people to get it. And we encourage you brothers and sisters them for let them really take the vaccine, because vaccination, not everybody believe in that. But even though you don't believe in them, it help. That's not one thing I will tell you. It help. I mean, I possibly believe in vaccine, not just because I didn't into the health, but I just believe the way you take vaccine, it protect you. And if you end up forget the disease self, which I always tell people that if you end up forget the virus because you don't get the vaccine, you symptoms them. It's milder compared to that person will not take vaccine. So just think of them in that way. Okay, so yes, welcome everybody where they watch me live on Facebook as well as where they watch me on YouTube. Within nice to Kakay-Diallo Facebook page and also on Salone Discoveries with KID-AFAN. So we get God's favor where you join me. It is a hello, ma'am, and hello, everyone. Hello to you too, and thanks for joining. And now we continue with the presentation slide because there are a few important points then we get for highlight. And again, this now more of the history. Okay, so if this now more of a classroom lecture, we go through each of the slides then. But we won't forget to things them where really they affect we own country, Sierra Leone. And that way we can now for come back and talk about how best we can able for protect people there. You know, there was a global outbreak in 2022, and that's not something we will not forget. And that was the time where them being now make the name from monkeypox, let it be Mpox, because that's stigmatization we wouldn't be worried about. This happened now in Europe. Now Europe self them be report the first case in Europe, May of 2022. So that happened, and you know, even though it not go on for too long, but it happened. It happened, and then WHO can always come, he declare waiting people them for do how for protect yourself and how for take things them going forward. Okay, so now we don't forget that. And we continue with the next slide. Um, More issues in Africa. Again, in Africa, January to May of 2022, most suspected cases of Mpox occurred in the Democratic Republic of Congo, wherein they been get 1,284 cases, and they been get 58 deaths where them be report. Then country alone been get that day, and then report that day. Okay, so again, in the first particular paragraph, I go back to that because I go back to them because Salone did it. Okay, Sierra Leone did it, the west part of Africa did it. So WHO in 2022 reported that Mpox was endemic in several African countries, including Benin, Cameroon, the Central Republic of Africa, the Central African Republic of, we're in Congo, and then you also get the Democratic Republic of Congo, Gabon, Ghana, where also Ghana, then we only report them saying that in animal, they mean phenom. Ivory Coast, Liberia, Nigeria, and Sierra Leone and Sudan. So this was back in 2022. So now we just know say this case if it done they gone. So we don't get them back. So the question where we get for ask ourselves at the end of the day, waiting will they do for ensure say then illnesses there so we then come. How well will they educate the public, the general public on vaccination? How well will they tell people and say, we take vaccine, it protect you, and where you continue for maintain that hand washing, that spacing yourself. If you're sick, you stay home, you not go now okay place, you not get yourself exposed, you not expose other people there. How well will you continue that community education, that patient care education, for let them understand, say, these are things them where we for continue for doing. They just say, oh, because this not a COVID time, so I don't need for wash me and I don't need for distance myself from somebody who is sick. So let's take a look at that and know, say, you know what, these are things then where we need for address and make sure, say, we not only address them, we want to make sure, say, we implement them and we also follow the steps there. All right, so we go continue for talk to we family them, we brothers and sisters them, and let them protect themselves. So there's a different period where you get this illness. So now Dandy, I just want for quickly highlight. Incubation period, meaning the period where the virus they last, from day 5 to the 13th. And also it can now range up to 21 days, right? So that's now your incubation period. And also for people that way don't pass the incubation period, like they look at 12 days and more. And the more further you days than day, the less sicker you are. Then you get the prodromal period. This not usually not the one where they last up to 5 days. So like where you first don't get exposed to the illness, where you get fever, you get intense headache, you get lymphadenopathy, meaning that bump where we talked about earlier in the beginning. You get back pain, you get tired body, you become very tired, and then also your lymph nodes then they swell. This can happen throughout, not to just one side. It would happen. Then you now get the face wearing rash, and then don't begin come. And this they happen 1 to 4 days after the appearance of your fever. So you don't get fever, the next step then you begin get rash. Okay, so now so the disease process they happen, and I believe now so we don't see within we brothers, then we don't suffer this illness. So within now this particular slide, within in the highlights in March of this year, and this now waiting the report to WHO, the countries then report within are the number of cases that we then get from January, 1st to the 31st, and also from the 20th to the March 2nd. So let's just look at this for a bit because it's important. On a global scale, meaning worldwide, then we get 129,100, 72 cases. Then we then report say then people that then get Mpox, right? And then in that particular number, the 283 people them, die from that confirmed cases. Okay, and then the number of reporting countries then was 130 globally. This was January 1st to the 31st. And then countries like Africa. So they go in countries like Africa, wherein we been get 19,922 cases in 2024. Then in 2025, when at this year alone, in just that 1 month period, the whole year, see how much they report. And then after the year, how much will they talk about? We left 5,247, then they report inside just January. And in that, 64 people have been died. And then also, and 64 people have been died for the whole of 2024. While in just this year, in that first month of the year, 19 people then died. So we see the rate, the speed of how people then they die from the illness. So that's concerning. Then we also been get another case from Republic of Congo, right? Then we report like 14,000. Out of this big number, then are 14,924. So now them we get the highest. And this year too, now them we get 2,415. And then we lost more people them. That year they 43, and also this year then lost 4. So now then get the highest number. But then we go on to up to March. March, we get a rate wherein 2,744 as Africa as a country, and then you get the Republic of Congo. So again, then they report more higher cases than the other part of Africa. So it's concerning. So then we look at this month we just passed, May. May we passed the current case for 2025, now 14,758 cases reported. And how many people that don't die? Then it report at 51, and also that was last year, sorry. And then this year now 67 people then wait and don't report. So in that we want for know waiting Sierra Leone report. In this particular one, March 10th to April 10, 2025, Sierra Leone, we country, report 1,275 cases. So if we go to the Ministry of Health and Sanitation, we're supposed to see then data there, so we at the point out, and also I'll be able for extract, then you presenting reporting where they do every week. And in that number day, inside April, March to April, we've been lost about 8 people there. Okay, so we've been lost about 8 people. So now we are focusing more on Sierra Leone, because Sierra Leone was reporting this year, from April 10th to the 20th of, from March 10th to April 20th, they reported 1,275 cases that are confirmed. And also that's over that time period. Then we lost about 8 individuals during that time. So let's see. So we just map out different continents and different countries then within we can experience, because there is this surge increase in the number of African countries then which constitute a public health emergency, of the international concern. This now within them in the field. The moment they see illness, the World Health Organization, or the Center for Disease Control Prevention, Africa, as well as Center of Disease Control Prevention, the United States, can get concerned as to then countries they are where they present themselves with all them illnesses then, because people they travel back and forth and what can happen. Sierra Leone currently, what they go on. So from waiting the Center for Disease Control Prevention Africa stated, and this now what in think. So the concerns about rising cases in newly affected countries such as Sierra Leone and the outbreak turning deadly. Okay, turning deadly also in Ethiopia. So that's not a big thing, because if you notice, as the CDC, the person with in charge, Dr. Nashihi, not so in report. So and then worry. And we remember, we not just get Center for Disease Control and Prevention in the United States, we also get an Africa. So then self they monitor this, and then they look at the countries them where actually they report then cases them, and it's really from within then they say just for this year, as of May, the number of labbed confirmed cases, is 17,845. Why this is important? For Lord, we take a look and Lord, we understand. Important because we just don't highlight the whole of 2024, the cases. Now we don't almost they reach so inside just less than, from May, that was 5 months within the year. So that's concerning. So let's also not forget that. So the cases are rapidly growing. And also, it continued for say, weighing continued emergency declarations, different countries are at different stages of the outbreak. Okay, so now Lord look at Salone again. Nwango said the outbreak in Sierra Leone is still very concerning and is driving illnesses, with the country making up to 53% of cases in most recent reporting week. Let that sink in for a bit. So Sierra Leone, they make up like 53% of the cases then when they report to the Center for Disease Control Prevention Africa. So what do you think? All the number of cases then we don't get more reporting in the last few weeks. So that's a public health emergency. That's a concern for the Ministry of Health and Sanitation, and see how best they explain this illness or the virus to the communities them. Because sometimes it's not just about posting online, it's also about sending out people out there to do sensitization in a help way, right? So this high population density and tourism are major contributors to virus spread, and test positive is as high as 100% in 7 of the country's districts. 7 of the country's districts, and we all know how many districts then we get. A sign that surveillance is still a passive mode, said, the person where they in charge of this. So Sierra Leone, you need to take this serious. This is important. So if we not be they take us serious, even the reporting itself, they tell we say they really at a high density rate of the Mpox. Okay. And what else did they point out for Sierra Leone? Okay, so then say something about we getting about 20,000 doses of vaccinations from the United Arab Emirates, This was reported on June 6th. So if you go na the Minnesota University of Minnesota and then na the website, you just type, you can able forget this particular information that was reported. So, but as for Democratic Republic of Congo, last week they received 100,000 doses of vaccine from France, and 1.5 million doses was also from Japan. So wait to Salone, what's going on with we? How can our people get vaccination? We get more cases, close to 53% of the reported last cases than we don't get. We get higher. So we not even get 100,000 vaccines. And are the people ready to actually take these vaccines when they do arrive in Sierra Leone? That's two questions, and we need to ask ourselves, what is the message out there? What would it tell people then? So that particular one day for be a concern to we country. We get more high cases them, but we not get enough vaccine for make sure we citizens then all get enough vaccination for protect themselves, and also we education to the public is also important, right? So this now waiting Salone report back in April, Wednesday, April 16th, 2025 at 3 p.m. The number of cases then we then report as we see how disgusting this rash look like, right? So they come from the Sierra Leone Mpox update. That's not the government of Sierra Leone. So the highest case in our Western Urban, we get 276. That was then. But let's see what's there now. That was then. And then again, number way for call, and also then they tell you the number of females that we get them, the number of people that we in new cases them, the number of people that we don't recover, as well as how many people then die from this particular virus. So this now the one we then report on the 7th, Saturday, June 7th, 2025, 3 p.m. Sierra Leone time. So we total confirmed cases na the country. Now, 3,782 cases were confirmed laboratory-wise. Number of people them we get active disease or active cases them 958 people them. Then we get number of new cases that was reported on that particular week was 45. And then how many people recovered? 72. And how many total recovery? We don't get in the country 2,804 cases, and number of deaths we then report was 20 people there. Okay, so and we see again the other districts where one for follow suit from western rural, western urban. We already know saying I then come higher. Bombali district get 218, followed by Port Loko 138. Right? So law we now take them numbers and very lightly. Law take them very serious. Law take them very serious for no say the problem they. But what you for do for make sure the people that know and aware of what's happening and how to protect themselves. So that's very important. So I believe say bringing that the mode of transmission we don't talk about. Close contact with somebody who gets the disease, and also contact with sores or rashes, touching objects in contact with the viruses can lead to the actual problem. And then you get the human to human transmission, which we don't talk about, and we also don't talk about direct contact and the spread throughout, from primary to the direct contact, from infectious sores, scabs, body fluids, and so forth. So Mpox can spread during activities that include close personal contact with infected individuals. So your mucous membrane, meaning your saliva, then side away you feel like bodily fluid, then thin and then put you at risk. Those are your portal of entry. Then are the way how the actual problem they transmit, they go through, and you get infected with that. Okay, so it's an ongoing worldwide outbreak where they don't report them. So it don't look like say it don't go. It hasn't gone because it's been reported since the end of vaccination for smallpox that was protecting people, but it also continues to be surfacing itself from last year, this year. The numbers are huge. And but the concern here are people getting vaccinations? Are people being educated on this particular um, virus? Are we following the steps, the different things that we should follow in order for us to protect communities, protect patients, protect ourselves, friends, family, loved ones, and the world at large? So there's more to be done. There's more to be done. And then again, you have the animal mode of transmission, which we highlighted. And then you have the indirect contact through fomites, meaning you touch a doorknob and that doorknob has the infected virus. You don't wash your hands and then you touch your mouth. And then what happens? You end up with the um, illness. And then you have your prodromal incubation period and should be monitored for up to 21 days, and also should receive a vaccination to protect yourself further. So respiratory secretions, we've mentioned, and you have the vertical transmission mode as well, right? So meaning the mother, if the mother, somebody is pregnant and gave birth, they have Mpox, their child can actually have that through the placenta. So if you notice some viral illnesses, they would prefer to do a C-section. That's to reduce the mode of transmission. Although the rate, they said, the risk is high, it's not known for somebody in a third trimester, but it's a risk. It's a risk, and we need to take note of that. So we have God's favor that added, thanks, ma'am, educative. May God continue to preserve you. Thank you. And also she continued to say, seriously, ma'am, I ordered to save lives. There must be a massive community engagement, definitely. So that's something I believe we see a lot of people doing it. The First Lady of Sierra Leone is doing it. Nurses across the globe and also in our country are doing it. I've seen that. I've seen entertainers, and that's very helpful. So we at KID-AFAN Global Discoveries, with me, it's important that we also bring the topic again. But we have discussed this before in 2022. So we'll continue to do our health discoveries so that we can talk to individuals. Complications, these are very much important. Complications with the vision is there. So people need to really take this very seriously. So you can see here, there's conjunctivitis, which is because of the Mpox. It's the highest, 8.9%, followed by impaired vision, meaning you can't see well, 4.3%. And then you also have the keratitis, inflammation, 3.4%, and also eye lesions can also be 3.4%. So these particular complications, goes up to 12.4% as a prevalence that has been reported. So let's know that the rate, is very relevant for us to pay attention to. And this is reported from University of Minnesota, this 2025. So let's pay attention to that. Okay. And also it is the most common complications, conjunctivitis. So the first thing you see, pink eye. Salone Morning, the eye, Mpox, they affect them. Okay, so you see somebody get a pink eye. So not for just take and lightly. So, and it cause people them for go blind. It cause the inflammation. It cause lesions them. So Lord, take all NTR very, very seriously, because you know what? It affects we. It affects we. It cause more problems than for we. This now more for the United States. So, but always way we they do presentation, we want for bring different parts, them, especially we where they live now the diaspora. If you go to the Center for Disease Control and Prevention, they report cases. Then get like the different strains, them the two different types of the virus where I mentioned clade 1 and clade 2, and both types they spread the same way and can be prevented using same method. So that's not something where we want for pay attention to. Okay, and also several travel isolated clade 1 pox cases. They don't report on the country. Them where we highlight Africa, Australia, Europe, Asia, and the North America as well as South America. Okay, so America self they report cases. These are some of the cases that where America report. This last year, then report a total of 4,635 cases of the clade 2 Mpox cases, and also then report cases like in only with the clade 2 was in locations like 4,300 something. So again, I want for push more towards Salone, because Sierra Leone we need more guide as well, because this country then gets the resources for make sure they then protect then citizens them. So we still depend fight that, yeah. So but in terms of total locations and where they report for America this last year, and that was like 93. And then also the number of cases them, compared to we own, it's not the same. And complications continues. So somebody can get bronchopneumonia, sepsis. We'll say sepsis when they talk about blood infection. So when you talk about secondary infections, them can happen. Then can get respiratory, you lung. They can get problem with the brain, when are encephalitis, and also when they get infection of the cornea, where we don't mention that complication that day. And also when they talk about you immune system, your white blood cells, and they become too many, plenty. You platelets where they help you, like if you bleed, within they protect you for letting not bleed further. Then the back can reduce. And also they get, you albumin level, then they become low. So you need all that, so multiple different complications that can happen. This now waiting happened in 2022. So if you go back, you watch this, you go able for see the different countries that where them been leased and so forth. So as we don't talk about them. Now, a lot of highlights, symptoms then where people then will present with high fever, chills, headache, fatigue, muscle ache, lymph nodes that are swollen, we mentioned, and also rashes, and back pain as well as body aches can happen, and as well as the fever can be above 38.5 degrees Celsius. So Lord, we not forget that these are some of the symptoms and we will present itself. And this now waiting and waiting you can begin for see we can to the visual examples them for the Mpox. And as well as this, they are very gross and not really pleasant to look at, but we get for just show them. And what you can do, they say how MPV is spread. I think we don't talk enough on that, and we just want to know how best we give for protect people them from that. And this also they tell you more symptoms them, this particular little slide with the dark skin, I think this one I get from we get for deal with and highlights Sierra Leone in general. So this was reported by our country. So headaches, back pain, shortness of breath, feeling exhausted, rash with blisters, okay, and also sore throats, coughing, swollen lymph nodes, chills, and fever. This nothing that we will not forget for no saying some of the signs, them, now the symptoms, them where you will present with. How you for protect yourself? Wash your hands, isolate yourself, wear mask. If say you sick, where you cough, you make sure say you cough and you sneeze will really, really help for minimize the transmission as well. And prevention, as always, is very, very important. The moment say you don't get exposed, make sure say you wear mask, you cover your mouth and your nose, you keep yourself, you distance yourself from other people, then you cover any rash where say the rash don't burst. If there's a bump you get, it don't burst, you want to cover that day, because this rash where it come, it get boiled and then it burst. That fluid day, now that water there or the one where they come inside bump or the rash. And if somebody else touch them, then they get sick. Okay. And the other thing, you need to get tested. Get tested so you know what's in they go on, and then based on the findings, you can now get supportive care. Why I say supportive care, what do we mean by that? If there's no cure for the disease or for the illness or for the virus, what you will need is vaccination and prevention and support the symptoms. Somebody have fever, you give them medications to control the fever and give them fluids. Make sure they're doing things that they can do and wound care. Because if that blister is open, now the person is going to have wound. They need to have proper wound care to prevent sepsis, blood infection. Getting bacteria into your bloodstream can be complications that leads to deadly things like shock, you know, leading to stroke. So different types, cardiogenic, neurogenic shock, and all these are different topics to be discussed at a different topic. Hand washing. Make sure you wash your hands, with soap and water. Stay away from people if you know you are sick. Let them know you are sick. You can't go out. You can't mingle yourself in crowd. That would be very helpful. And the vaccine is out there. And please, if you can get access to them, please get it. Please get it, and let's continue to stop it. The take-home message for this particular presentation is, first, are you exposed to Mpox? If the answer to the first question is yes, are you experiencing any symptoms? And if that also is a yes, this is some of the things that you do. Stay away from any skin-to-skin touching, contact. Even if the person is your spouse, stay away from them. And same goes for wearing masks, washing your hands, seeking medical help to ensure that you are protecting yourself, you're protecting your loved ones, you're protecting communities as well as the country at large, and then you reducing the spread of the virus. Because the more people who if one person gets sick, they don't protect themselves, many people would get sick in conjunction, in addition to that. But if you don't have it, you continue to take all the different precautions. So if you're not exposed, take the precautions. Wash your hands. Cover your mouth when you're sneezing or when you're coughing. Don't just spit and spread it out on the floor like that. So salon family, where say you get symptom, you get for stay away from your man, from anybody where say he go touch you, go hug you, go do things and to you where you're not supposed to do to you. That way you self the add for help fight the illness, for help fight the actual virus where they go on. We didn't take lives them. We don't lost brothers and sisters them. We pray for them. All let God sorry for them. Let God give them good. And we were left low able for educate the one and we sick with them right now. We talk to them. Let them know the different symptoms. If you feel tired, you get headache, you in the heart, you get boiled by you, and that boil they boss, you get for cover them, you get for make sure say the wash yan, make sure say if because what thing they get for do for you, not to say they get medication or where they done them. Now that symptom where they feel, where your temperature they above 38 degrees Celsius, then give medication, paracetamol or Tylenol for make sure say your temperature go down. And then also then they tell you now say wash yan, cover your cough, not go to touch people, they're not the hug. If say event there and that you sick, no go there. Not go there, because at the end of the day, allow that person sick. The more people that sick, now the more the disease they spread. And already we don't talk about, how much we don't report. In the last couple of weeks, Salone they at the higher mark. So law protect yourself, law protect with communities, law protect with loved ones them. So that now the take home message, and we can always kind of back. These are some of the references them where I pick up some of the informations they are so for can present and so now. And not forget to say this now KID-AFAN Company Limited, and they can't rush because that morally duty they can't take this. But I appreciate everybody who take the time for day with we now. So today we appreciate on our time and continue for follow we now the different social media handles them we now KID-AFAN Salone Discoveries on Facebook, Isatu Kakay-Diallo Facebook page, and also Salone Discoveries with KID-AFAN. And now we website, we're now KID-AFAN.com, where you did able for access all the different social media handles them. And as always, we can always bring discoveries them, whether I get for deal with health, fashion, different types, entertainment, but we'll go try. If now once a month, self, Lord talk about health. Lord talk about health, not to just the entertainment, no more. Me focus really, we want for educate and sensitize people in our country. You will watch, we comment. I appreciate everybody for being here today. I appreciate the comments, and if you get questions, feel free for always go to the previous after the stream. Definitely just comment and I will respond accordingly. And if people don't want for discuss a specific health topic, just send me a message. We can make it happen. We can talk about that. On that note, I say many thanks to now all once again, and also we love we stay safe, love stay blessed now we country, because Salone now we country, and we want to make sure that the country stays safe and healthy. But how can do that? Through hand washing, vaccination, prevention is better than cure. Okay, complications and they happen where you die and can get affected. Even the infection or the virus can lead to sepsis. Sepsis is very deadly. Trust me, as I repeat, and so it's deadly. So if you begin get sore throat, you get swollen lymph gland, you get headache, you get back pain, shortness of breath, feeling exhausted, and any rash with blister, don't take it lightly. Go get tested, wash your hands, isolate yourself, wear mask, cover your sneeze and cough. It's very important, because this is what it get for look like. We don't lost so many people then lately. Believe it or not, even if you lost 2-3 people then, it's scary, and we don't want to foresee that continuously. So again, they reverse this slide so as we end this. The cases then our country is very scary. As it's scary, let we find ways in how we can protect citizens them, and we call on we government for let them continue the good work. We know say una they try, but we know say una can do more. Lord fight, Lord get vaccine, Lord educate the people that are the country. Sierra Leone now one salary we get, we all na Sierra Leoneans them wait for make sure say at the end of the day, we country stay safe, we country stay blessed, and that's I will always say again, until we meet again for another discovery update or discovery in health. And me now, Dr. Isatu Kakay-Diallo, and I report live from, I present this particular topic to now live from KID-AFAN Global Discoveries now New York, and also as always, when I know say we get the KID-AFAN Discovery team now Sierra Leone, we in a KID-AFAN Salone Discoveries. Then they report on issues them in person. Then we'll talk to you if you need any coverage. Reach out to me, email we, follow his social media handles them, and then we can definitely do we part for make sure say we'll bring una whatever matter to Sierra Leone. Until then, me na Dr. Isatu Kakay-Diallo, family nurse practitioner, board certified. I sign out, and I want to say stay blessed and stay healthy and protect yourself. Thank you.